Hey everyone, this is Nathan with Saybrook Insights. It's good to be back here today. We're going to kick it off in high gear. To say healthcare in America is struggling right now might be the understatement of the century, not to mention our public health infrastructure and everything that informs it. So that's the high gear we're in, right? There's a lot going on all at once. And it's a heck of a day to start today's interview with our very own Dr. Luann Fortune. But it's a springboard to identifying ways we can truly make a difference, potentially, across the entire healthcare landscape. And suffice to say, it includes healthcare leaders across the country working together in different and more meaningful ways. I've seen, and I'm sure all of you have seen firsthand or even secondhand, the ways in which hospitals and health systems work. And so much of it can seem dysfunctional. Whether it's the transparency of costs or the way insurance is billed or received from those healthcare institutions, or the quality of patient care, the sheer cost of care, often bankrupting families or creating hardship at a very minimum, our healthcare systems are struggling under the weight of their own bureaucracies and a regulatory system and often nearly impossible expectations set by their boards, their communities, insurers, and even the patients themselves, and I count myself among them. In the midst of this, our healthcare leaders are really challenged day in and day out to find new ways of doing business sustainably, under budget, and at the highest level of quality possible. Add to this the very rocky landscape of reimbursements, and one wonders, how are these folks staying in leadership to begin with? So while it's easy to focus solely on any one of these issues as the issue of the day, we're not addressing the whole system, including how we work together as a community to advance everyone's health and well-being, and that's where we need to be. On top of all of this, we have a very bifurcated system in the United States related to what we call traditional healthcare and then integrative medicine and healthcare. And then there's a whole slew of other terminology, complementary, alternative, et cetera, et cetera. And untangling all of that and understanding where that all fits in is also part of that systems issue that really needs to be addressed if we're going to make a difference in how we advance the care and well-being of the communities in which we serve. Enter into this conversation Saybrook University's Dr. Luann Fortune. She's a faculty member in our mind-body medicine programs, and she joins us as someone with vast experience across an array of different career positions, from corporate to healthcare. And she brings a systems mindset, and her focus in her work, scholarship, and practice is mindful leadership in healthcare settings, along with complementary healthcare techniques that support whole health and healing. I'm really looking forward to exploring with Luann the various ways we can evolve our systems and practices that support a more systems-based approach to healthcare and patient empowerment. And despite my rather doom and gloom opening, I guess, I actually think there is tremendous opportunity and potential to envision and actualize a new reality, or maybe it's multiple new realities in healthcare. And it's going to be people like Luann Fortune and maybe people like you who help us get there. All right, here is Saybrook's very own Dr. Luann Fortune. Luann, what a joy to have you as one of our leading faculty from the College of Integrative Medicine and Health Sciences and the Mind-Body Medicine program. Before we get started, I'd like you to tell us a little bit about yourself, your personal history as it relates to healthcare leadership, and integrative health, and how you came to Saybrook.
Well, thank you for asking that. I'm delighted to be here. I love sharing my personal history, but also I love talking about integrative medicine and about wellness. So my personal story is one of serendipity, or maybe we can say synchronicity, the way things fit together nicely, paying attention to the coincidences. So I think I finally intentionally learned how to do that. Looking backward at my resume, it doesn't make any sense. And if I had the ability to help look forward at it, it wouldn't have made any sense either. But it makes complete and perfect sense to me right now. Because I started out as an educator. I started out as a teacher, and when I finished up my 5th year in California, there were no teaching jobs. And I went on to a totally different career for 10 years in for-profit business in the travel and transportation business. I was a trainer for United Airlines for 7 years and worked my way through, became part of a management consulting firm that just did travel and transportation, was bought up by a company, became a vice president with Citicorp when I was in my early 30s, and became a victim of my own success. So I found that I was hurting myself. I was overstressed. I was what we consider right now just normal in understanding what happens to people when they put themselves through a lot of stress and strain. But back when I was experiencing it, didn't make any sense to me. And somehow my assistant found me a massage therapist. And I would leave the airport on a Friday night because I had apartments in Boston and in London. I traveled around the world with our clients.
Wow.
And I learned how to be a really good presenter and I learned how to be a really good talker, but I hadn't learned yet about self care. So it was my assistant who found me a massage therapist. She said, I think you really should try this. And back then, I thought that was just bizarre. I'd had massages when I'd gone to spas and resorts, but I never would have thought about it for taking care of myself. And my life was changed in seeing this woman on a Friday night before I went back home. And one night on her table, she said, you know, you could do something else. And I thought about it and I said, yeah, I want to do that. I want to do what she does. And when I gave my resignation to my company, they sent me to see the staff psychologist because obviously there was something very, very wrong with me. And it took a while, but ultimately I went back to my massage. I went back to school. I got certified in massage therapy, and back in the early '90s became part of the movement to license massage therapy as a health
Oh, wow.
care profession. So I took up advocacy on the part of massage and massage therapists. I helped get the first law of licensing passed in Washington, D.C., where I lived. My clients were corporate clients, which I understood from my own experience, as well as individual practice. And moving through this, I became a mainstay in my community, doing community workshops, everything from massage for families and for babies. I did a lot of pro bono work in places like border baby programs. And I sat on the first licensing board for massage therapy in DC.
I did not know that. That's so interesting. Very good. Sorry, I didn't mean to interrupt, but
No, 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 no. You just channel me because you can tell. I'll just keep talking. You just said, tell me a little bit about your background, and here we
that's
go.
fabulous. Yes. Oh, wow.
So, how did I end up here? How did I end up at Saybrook?
Yeah.
So I was also teaching at the Massage Institute, and my students would come up with questions, and massage was just starting to be recognized as a healthcare practice. When I started, there were 3 states in the US that licensed it as a healthcare, recognized as healthcare. Uh, Today, there are 47, the District of Columbia, Puerto Rico, all the territories are recognized, as well as globally. And part of it is because we have research that backs it up, but it's also because of a tremendous need. Baby boomers were aging, our bodies were falling apart. We had a greater priority for learning about our own self care. And my students came to me at the Massage Institute with questions I couldn't answer. So I started looking around at different ways that I could go back to school myself and become more knowledgeable. And I looked at psychology programs. No higher ed to this day. There's no PhD in massage therapy that I know about. But I also knew I was taking a more holistic approach. So I ended up getting a PhD in human development. And that's what I have. My research has been around massage therapists, how they work with clients, what their experience has been with licensing and the process of professionalization, and how massage fits in as one of the complementary practices that we know of today as integrative healthcare.
That's great. And then you found your way to Saybrook after that. Like, I mean, what a rich history you've already given, but And you've been at Saybrook for a while. So how did you find your way to us?
Well, there was no program in mind body medicine when I was in my program doing my Ph.D. And one of my committee members knew about the work of our founding program, Jim Gordon, Dr. Gordon, and she knew about his work, and she introduced me to him and to Dr. Donald Moss. And I had just defended my dissertation when I met Don Moss, and pretty much hired me right on the spot, but didn't have a job for me yet. So that was back in January of 2012. So I've been around since almost the beginning. The program was fairly new, and I've just been so honored to be part of building the program, not only in mind body medicine, but in complementary and integrative healthcare that we have had such an influence on practice. So I think of myself as a scholar practitioner to this day. I'm licensed in 3 states. I'm board certified as a massage therapist, and I'm certified to teach continuing education credits to that profession.
You've got it all. I mean, you just bring it all in. That's fabulous. Yeah, that's terrific. And you think about, like, you really pointed out an important aspect of the fact that you came in really almost on the ground floor. I mean, not quite, but really at the ground floor in 2012, right? We just celebrated our 10-year anniversary with the College of Integrative Medicine and Health Sciences, the Mind Body Medicine program. And, just for the audience, Luann has been an instrumental factor in that program. Started, I believe, with like 9 students. I think today it's hovering around 250. So it's grown quite well, and you've been an integral part of that for sure. How have you, when you look at kind of the landscape of integrative medicine and healthcare right now, and we're going to get into some details around the healthcare industry because I know you teach the healthcare leadership, mindful leadership specialization, but I am curious where you see things headed in terms of integrative medicine and health, because you were on the really ground floor with massage therapy. You've seen it evolve. What's happening, churning right now in this space as it relates to mind-body medicine, et cetera?
Nathan, that's an excellent question, and it's one that we continue to ask ourselves. And because it's a scholarship-based program, I monitor the research every day. I'm watching to see what's going on in research, but I'm also active in practice. So I stay involved with what's going on a practice level. So for an example, 10 years ago, integrative medicine was not a term. We talked about what I'm doing and what we're teaching is CAM, complementary and alternative medicine. So NIH changed that. They changed the terminology, and the words we use are powerful. We believe that, right? Because we're scholars. So it's the way that we write things, the way we talk about things, and the system, because I see this very much as a system of healthcare delivery and healthcare consumption and healthcare promotion, as well as healthcare as an aspect of mind, body, spirit. So what's happened over the last few years in integrative healthcare has been really interesting. Up until about 3 years ago, I think we'd all anticipated that integrative medicine had an opportunity that came out of the opioid crisis.
Mm.
And that, in large part, is because there was a turn away from pharmacological interventions because, in many cases, they just were not working. And we have seen repeated cases of trauma. For example, the U.S. military is one of the largest consumers of integrative healthcare to this day. The VA system has been instrumental in very different places across the country in introducing different practices. So initially we were looking at things like massage therapy or chiropractic or acupuncturist components. And now we have a better understanding that it's an entire system that is what can be part of the movement to changing the way we deliver and experience healthcare. So there we are on the cusp of this about 3 or 4 years ago. Big opportunity for integrative healthcare to step in. I was actually part of a group that lobbied in Washington, D.C. We provided testimony to congressional committees about exactly this. Opportunities for working with underserved populations. And then we get COVID.
Yeah.
So what happened then in 2020? Who wants to talk about integrative healthcare when everything is being triaged as an emergency?
That's
When
right.
we go back and we entrench in primary care. And we were still seeing some integrative healthcare being used for COVID, but it was happening in different parts globally, or it was happening to mitigate what the effects were to help with recovery. Today, I'm sad to say that I think the biggest opportunity for integrative healthcare is in long COVID.
Interesting. What do you mean by that? Yeah, let's explore that for a minute.
I think a year from now, we are going to be seeing studies about how practices and approaches that we find in integrative healthcare can mitigate some of the aftermath of the initial wave of COVID
Hmm.
19 and what we've experienced. I don't think we know yet what the full effects of long COVID are going to be, except what we've seen so far is they are serious and they are going to affect entire populations. There are very few families or communities that haven't been affected by this, and we're going to need better solutions. And primary healthcare emergency triage is not the place for it. Biopsychosocial interventions are what can be called for here.
Yeah, that's a very interesting point and an important one, I think, at that. As look at some of the treatment methods that integrative medicine can contribute to, especially like with long COVID, this is fascinating to me because I don't even think I put those two things together recently. So you're helping create those synaptic connections here. What do those treatments maybe look like in concert with traditional Western medical techniques? I mean, what's kind of coming top of mind for you right now as a practitioner?
For myself and for my friends, I consult regularly with my naturopathic friends and colleagues who are in practice and what they're experiencing. I'm monitoring the literature around that. Things like brain fog is surfacing to the top for long COVID. There's problems with it. We have found that some supplements have been very effective in mitigating the effects of brain fog. So we have supplements that are one aspect of it, products, and there are models in integrative healthcare that explain this. There are also body-mind interventions, and that can move from meditation and mindfulness practices to some of the mindful movement therapies, such as Feldenkrais, Alexander work, or anasomatic education, which one of my students just defended his dissertation on last week. One of the first places that we have documented anasomatic education work. So there are practices that will be able to help with that. Individually, people are showing up with a wide range of long COVID symptoms, and there are opportunities in all of the sectors in complementary integrative medicine to be able to match up with possibilities. And because integrative medicine by its very nature is client-centered, patient-centered, we can take a look and provide a menu of possibilities. And the research is starting to come out. There are places in the world where they did not have the medicinal or pharmaceutical remedies that we did, and they were treating COVID-19 in their hospitals with vitamin C, with vitamin D, with what are the effects of melatonin? So that's on the supplement side. How does meditation and mindfulness practice mitigate the brain fog and help with the mood disorders that are also showing up to be rampant as part of the side effects long term? Lots of opportunities here.
Lots of opportunities. So if you're a student thinking about mind body medicine or you're in mind body medicine, I think Dr. Fortune just gave you a fortune of ideas to kind of work with. That's really tremendous. I appreciate that very much. Can you, just for our audience, also speak a little bit on the work that you've been personally engaged in your research and the interesting things that you've been doing kind of pre and now kind of during post COVID. And you've also been doing this little thing in quotes, a mindfulness moments type of experience for the university. So maybe touch on those for a few moments. I know we'd love to hear about them.
Oh, thank you. Broad spectrum here. First of all, I want to promote my work and my interests. My first priority actually is working with my students. So most of my research is supporting my students in their successful research. I set that as one of the highest priorities in my work. I am so proud of some of the work that they've done. And in my time with Saybrook, I have chaired 35 or 40 dissertations. And and many people at other institutions don't have the opportunity to do that kind of rich work in such a short period of time. So that's important to me. But overarching, I've also had the opportunity to contribute to my own interest, which is in somatic experience, meaning body based first person. And early on in my own research, back to when I was still a doctoral student myself, I was fascinated by how the body comes into our research, how the body participates in particular, qualitative research, but all aspects of it. So my writings, my research now is really focused on how we put our whole selves into our research process. And that's actually the title of a book chapter that I published recently, You Put Your Whole Self In, which introduces a model that I've seen tested through my students of how do we invite in mind, body, spirit into the research process. And I think they've done that very effectively. We try to do that in Mindful Moments too. So it's a wonderful program, and I really want to give a shout out to you for your support of that. As you know, it was very organic back in the spring of 2020. My faculty colleagues in mind body medicine and I looked around and we saw a lot of hurting, a lot of confusion, a lot of isolation as lockdowns were happening all over the country, the world, and confusion. And we weren't even able to be in the same room with each other. But we have this amazing technology which allows us to transcend the reality that we're communicating now in a two-dimensional universe to be able to project ourselves out into it through a transpersonal sort of experience, through the very techniques that we're studying, that we read about, and that we're researching ourselves. So we came up with this idea of holding little mindfulness sessions to bring our community together, to have the opportunity for people to settle, to ground when all the chaos was going on around us. And thanks to your support, and also because it was important, serendipity, right?
Yeah. Yeah.
Finding that moment of synchronicity where people showed up and they came. And as you know, we recently presented on the program at a WASP conference. We've been doing this for over 2 years now. The program has podcasted scores, hundreds of these sessions that have a wide spectrum of mindfulness practices, from body-based to spirit-based to much more transcendent meditative bases, all with a little lesson, some with less lessons, but ways to connect people. And when we've surveyed Saybrook and beyond, because we've opened this up to the public, anybody listening to this can show up for Mindful Moments on Mondays and Fridays live, or tap into Saybrook's website for Mindfulness Moments to get our podcasts. When we've surveyed, the most consistently important thing that showed up is community, and how important the virtual hug has been to people during these times.
Yes, yes, amen to that. And really, this is a love fest here because I think, well, I appreciate the shout out. Listen, faculty across the country and especially at Saybrook, I guess I'm partial or biased here, are very busy and engaged, and our mind body medicine faculty and their colleagues and guests who join them periodically from our different programs have largely volunteered a lot of time, hours, and into giving this really life. So you can find the podcast, just for those of you that are interested. The offline version is Saybrook University Mindfulness Moments, but as Luann noted, we do invite the public in, so that's always an opportunity. Thank you to you and your faculty for doing this, and the work that you're doing day in and day out.
Oh, they are so wonderful. I mean, all the faculty who participated in this, along with some of our students, our advanced students who do this work, who volunteer to show up. And a big shout out to Sandy Lee, who's our teaching assistant, who coordinates the whole thing for us. We're all just chipping in and doing it together. It's a wonderful example of saber collaboration.
There you go. There you go. So I want to shift gears. I want to get into the healthcare system in the United States. So it's a big topic. And I'm pretty sure you have some thoughts, opinions, and very informed opinions and thinking around this. We know our healthcare system, well, I shouldn't assume too much here, but I think most of us would agree that it's challenged at best, and some would say broken. Whether it's lacking transparency to the variable quality of patient care, to the insurance challenges and how our patients, and we are patients, some of us at some points in time struggle to pay for that, to the leadership challenges that are throughout our healthcare systems. What's going on from your perspective? And you alluded to this a little bit in your opening remarks around systems and the systemic approach to analysis and understanding. So I'd be curious what your thoughts are on this. And maybe let's start with transparency in healthcare. What does that look like? And we can kind of go in and out of these topics as you feel comfortable.
Thank you. Transparency is sort of interesting because there's an increasing body of literature that's building up around medical mistrust.
Interesting.
So, and that's not directly related to how I will respond to your systems question, but I think it's critical because it's not just in the United States, it's globally too. And it's been a particular problem during COVID
Yeah.
because if you don't trust the very people who are holding the vaccine to be able to take care of your health and wellness, then we are all in a lot of trouble. In the United States, we have an interesting situation because we are beyond reach the most expensive healthcare system in the world. For example, I think several years ago, I had the opportunity to go to Cuba and take a look at their system.
Mhm.
We were very interested in how they were using integrative healthcare down there, which is sort of funny and looking back on it because they don't have integrative healthcare; they just have healthcare. It's like when I used to talk to my father about organic gardening, he just did gardening.
That's right. That's a great point.
So in Cuba, they have roughly the same outcomes that we do in terms of life expectancy, in terms of chronic illness, but their cost per individual is less than one tenth of our cost. And yet we still have in this,
That's fair.
it is staggering, and still in this country, we have millions of people who are not only, the big problem is not that they are not insured, but they are underinsured, that they are one cataclysmic illness away from being in bankruptcy and or being homeless. And then we have this other whole problem. So I will not miss the opportunity to pitch the idea of the social determinants of health and how important that is to the way we in the Department of Mind Body Medicine curriculum look at health and wellness. That it is not simply one thing, it's not the service that you get. However, back to your question about our healthcare system in the States, we have one of the most complicated complex systems that you can find anywhere. And if you take apart all of the stakeholders, including the lobbyists, including the pharmaceutical companies, including the regulatory bodies, there are so many people and bodies that are involved that don't have to do with delivering healthcare, that they have to do with ensuring healthcare or not ensuring healthcare or tracking who insures healthcare or we can go on and on with all of the stakeholders that are involved here in the United States. So the alternative is very simple, but it's not necessarily very popular, and that is to nationalize healthcare and to eliminate all of the bodies that don't have to do with delivering and researching, providing healthcare.
Wow, Luann. Oh my, you've just stepped into the landmine of healthcare politics, but this is good. It's good. So the nationalization of healthcare comes with a lot of challenges. As does our current system. So you're saying that by nationalizing, we would be able to segment off or eliminate a lot of these regulatory pieces that are part of this and kind of bring it all under one umbrella. Maybe talk about what that looks like, and maybe also talk about why shouldn't it be so scary? I mean, because I think a lot of people get scared about when you say nationalizing healthcare or single payer systems, it's wrapped in socialism or this, that, and the other, and a lot of other political rhetoric gets kind of bandied about. So, what are your thoughts around those issues?
So it's such a political topic, and thank you for asking. And I'm not afraid to step into that, although there are places where you can get thrown out of restaurants for talking about this topic.
We're a university, so that's good. Yeah, yeah.
Yeah, absolutely. I think the issue on people who resist or who think national health care is a scourge, and those who are mistrustful of it, all come from both opposite ends of the same spectrum, and that is health inequality. That's the lack of equity that's associated with the system that we have here. So I'm very active in an organization called I Am for Us, plug for I Am for Us, Integrative Medicine for Underserved Populations. And integrative medicine can fit into the Medicare and Medicaid model as well, but that's probably a whole other podcast. But whether or not we resist national health care also depends on what level of income, what availability we have, what is our access to health care. Because if we have unlimited financial resources, then possibly national health care might look like a threat, that it's going to take access away from us, it's going to take something away from us. Or what about all the people who don't even have basic primary care, who can't get basic perinatal care, can't get basic infant care? The infant mortality problem in this country is terrible, and there is a huge equity issue around that. So it's the haves and have-nots, Nathan. And that, unfortunately, is much like other things in the United States, such as housing, affordable housing, access to clean air, clean water, and all of those pieces of the social determinants of health that go into making us capable of being the wellest people that we can be individually.
Yeah, fair enough.
So I might be getting off track a little bit here, but I don't want to insult those who are listening in who think that we have the greatest healthcare system in the world. What I'll say is that that might be true for some, but it's not equitable.
Well, and I think if you look at the healthcare outcomes right now in the United States, we're definitely not at the top of the heap when it comes to the points you raised, infant mortality in terms of general healthcare outcomes. We do have, and I think to be fair to our healthcare system, and not saying you aren't being fair, but we have some amazing healthcare systems in this country, and some valiant, courageous, and incredible doctors and surgeons, physicians, and practitioners. But to your point, it's the access and equity of care that is really at issue when it comes to how healthcare is delivered. I would also say, I mean, I think it's really interesting you bring this up. As someone who obviously is in my role, I'm often talking about budgets and finance, probably sometimes to the point of distraction for some. But I think it's when you look at the cost of healthcare and the benefits to the bottom line of a nonprofit or a business, what we often miss, I think, in the healthcare debate is employer healthcare is great for those who are employed, and employer healthcare is fabulous for those that love their employer healthcare. But in terms of the richness of the offerings that can be provided, it is so variable depending on the employer, depending on the job that you reside in or that you're a part of. So I think you raise an important point for our audience to be thinking about in terms of the whole system of healthcare and what that looks like. I'd like to sort of bring us into this discussion too, though, around, okay, so we've got the system we've got at the moment, short of a national health care referendum, which doesn't appear to be coming anytime soon. What are some ways that, you teach in, mindful leadership? It's a really powerful set of courses and techniques that you use. When we see our healthcare leaders out there trying to enact change, trying to, be part of this, and yet they're, just sort of, many of them are drowning under the weight of bureaucracy, regulations, et cetera. How do you coach? How do you support leaders in that process? What is the what do you bring to the discussion and to the practical skills that they can apply in their day-to-day work, especially working with practitioners and healers of all types?
You know, Nathan, I think you know this because one of the keys in what you've just said is there's a difference between leadership and management. And it's important to manage your budgets and to look at your bottom lines and to also know where your personnel are sitting on an org chart. But the part about leadership is that your leaders have to have a vision. They have to hold a vision. And one of my students did her dissertation research around one particular integrative healthcare facility that's pivotal. It was one of the seminal ones. And what she found was the one key factor was the vision of the leader and how he held the space for the people around him to be able to move through the challenges of trying to get through patient triage and working with iPads while you're trying to talk to somebody and emergencies and pandemics and all the other things that go on. And at the same time, practicing himself that we need to hold the pause that mindfulness teaches us to take time ourselves to breathe and take care of ourselves and to take care of the space we're in at the same time of holding on to the vision of where we want to go. Because if we can't hold that vision, the vision where in a utopia kind of place that all people can become the best version of themselves they can be in mind, in body, and spirit, and to allow them the space themselves to be empowered to pursue that, then the management stuff doesn't matter.
Mm, mm.
The leadership and the vision piece that has to be key to it. So one of the concepts in integrative healthcare is you empower the individual patient to take care of themselves. So we have spent so much time and money and power invested in a particular kind of medicalized treatment that we have missed out on opportunities to help people take care of themselves in ways that might not be so costly and might not hit somebody's bottom line the same way. And I'm guilty. My retirement fund has probably got lots of those entities in it that I'm talking about right now. But in full interest of transparency, it's part of the problem. So if you peel away that we don't have a national healthcare system, what do we have here? We've got a much bigger for-profit system in this country, and healthcare is a big part of it.
Mm-hmm, mm-hmm. And so addressing those, kind of cost issues and patient quality outcomes, I hear you saying, I think, is that, I appreciate the distinction you made earlier with Cuba, that it's just healthcare. It's not distinguishable between integrative and I don't know what it is, non-integrative, but Western and non-traditional. But for where we're at in this country, what I hear you saying is ultimately, many of our leaders need to make, they're going to be more successful if they make space and make place within their leadership and within their communities for that vision to sort of manifest itself as to what they want to see within their healthcare environment. Two, if I'm understanding correctly, that, in order for us to really start moving the needle, given that we are where we are as a healthcare system, largely for profit, and driving towards outcomes that maximize those revenues, that, reducing the I guess the cost continuum by empowering patients to engage in more of their own health care through these integrative techniques. Is that fair to say? Did I miss the boat on that?
There is, and there's another piece I'd like to contribute. We have
Sure.
seen an explosion of mindfulness in leadership in the last several years. One of the things the lockdown was good for is research. We've had a lot more research coming out in different directions than we might have anticipated in a 2-year period. The mindfulness in healthcare leadership literature, the research, and this is empirical, is showing a lot of correlations between, and they're not strong yet, I mean, so I'm not going to try to blow this out of proportion, but we are seeing
Sure.
correlations in terms of individuals who embrace mindfulness practices and their ability to self-regulate, their ability to reflect on what is going on in larger their environment, their ability to cultivate their emotional intelligence and relate to their staff and their colleagues in a more humanistic sort of way, as well as their patients, their ability to make ethical decisions,
Mm.
which is interesting in this time and place, especially now where we're faced with so many challenges and potential shortages. So I also realize I'm talking about individual mindful leadership on one hand, and I'm also talking about population health on the other. And how do these things mesh? Well, there actually is some of that going on because there are different places experimenting with different delivery models that try to address inequities in healthcare and also bring in integrative practices through use of group medical models, for example, that have integrative components to them and can be funneled through the Medicare Medicaid system.
That's interesting. Okay. So there are those things that are starting to arise out of the field and the disciplines and in practice
Right, right.
that can be reimbursed. Okay.
So I don't know if I addressed your core question because I know I'm all over, but there's so much to say about this. Can I have another couple hours to talk to you?
Yeah, right. I mean, if we had 3 hours, boy, we'd be on here forever because we would have a fun time talking about it. As sticky as these issues are, they are and do require a lot more conversation. So, I mean, I think as we scratch the surface here, recognizing that we'll have to have you back to talk in more depth and perhaps with some of your colleagues about this and how we can start to crack this nut of healthcare in America as we see it right now. I think one of the questions that emerges for me, especially with the mind body medicine program, because I want to get into this a little bit with you and talk about, the degree itself. But we have so many interesting folks that come to us as students. So doctors, surgeons, nurse practitioners, physicians' assistants. I mean, I've met a few of them. You've met all of them, or presumably a lot of them. And, I'm curious as to why you think it is that they choose to come to Saybrook for this mind body medicine degree program, or what one of our many programs, but I want to focus today on MBM. What are some of the reasons you hear from them? And then I guess kind of a quick follow up to that is what are they doing with the degree? Where are they at with that?
Well, some of those people are the same heroes I talked about because they've got a vision. That's it's part of their vision, and then they're going to go on to hold it for others too. So I don't think this is for the faint to take on a whole new territory. We're in new territory, as but I was doing that too. But when I was in my doctoral program, I remember one of my mentors told me that the job I was going to have hadn't been invented yet.
Mm,
And he was right. But all we need to do is look around us right now and see how quickly the world is changing and know that we need some innovative thinkers who can look at things differently and also appreciate that what we've been doing in many regards in healthcare has not worked so well. So, if you're called to conventional medicine, there are many different routes for you to go down. But if you're called to innovate in a different sort of way, Saybrook offers something that is completely unique in our mind body medicine program.
that's great. That's great. And so these physicians or healthcare practitioners who come from that space see us and find us. What are you seeing them doing in terms of scholarship and application?
And it depends on the individual. Some of them are taking what they have learned here, what they've researched here, and how they have developed, because this is a transformative program. And they're going out and they're introducing new programs and some incredible examples of that out there right now. Others go back to their niche, whatever it was, be it a psychotherapist or an occupational or a massage therapist, but they're doing it much broader, bigger ways. They might be leading organizations while they're doing that. And then we're seeing also a change in our students as integrative medicine changes more and more to a shift to the individual learning how to take better care of themselves. More and more educators are coming to us. And I know just,
Interesting.
yeah, not just educators who are I mean, I've got students who are teaching in primary school. I have those who are teaching in community colleges. And they want to take the work that they're doing as educators to a higher level. That really excites me.
That is awesome. That is part of the important work we need to be doing nationally and locally for sure. All right. No, that's great. So, maybe in a nutshell, since we're running a little short on time, again, we could go for hours here, right? Briefly describe the mind body medicine programs. We have a master's and a PhD. What does that look like, again, in a nutshell? And for our students or prospective students that are interested in this, you can find us online and I'll give you information on that here at the end. But Luann, what are some kind of nuggets for our prospective students out there?
Master's program have 36 units of credit, 32 units of credit. Depends on what you do in your minor. It depends on whether or not you're going to do another certification. For example, you can get your certification as a healthcare coach as part of the program, and many people do that, and that is an ICF certified program. In our PhD program, 75 units of credit, which includes the time doing your dissertation, or the credits during your dissertation. And it is original research. You put together your own question, you form your own committee, you get a lot of support for us. 21 units of research courses are embedded there, and you can choose a concentration. As you mentioned, mindful leadership in healthcare is one of those concentrations. But there are others too: applied psychophysiology, integrative functional nutrition, and our new program in contemplative end of life, which is a really exciting specialization. We're seeing a lot of interest in those who have been doing hospice work or nursing work already in one form or another, coming in for that.
Okay, great. And so you can pursue that at the master's or PhD level, those specializations or concentrations in either program?
They're minors at the master's level, they are specializations at the PhD level.
Great distinction. Okay. And then so master's about a year and a half, 2 years. For a PhD, what are we talking about in terms of time and commitment? If a student is really motivated and they want to kind of move through and really get the information, and not only get the information, the skills, about how long are they looking at, and what's the credit unit for that?
You know, one of the nice things about our program is it is flexible so that you can take as little or as much time as you need as long as you move through and you've met all the requirements. So if you're doing a master's, you're probably looking at 2 or 3 years. We have a capstone project, capstone essay project at the end of it. So it's usually pretty limited at the end to one semester. Some people take a little bit longer. On a PhD, it depends how long it takes you to do your research. So we're finding that students take 2.5 to 3.5 years to move through all of their coursework, and then they can take anywhere from 1 year to 3 years doing their research, depending upon what their research is.
Okay. So about 4 to 5, maybe 6 years at the most.
But the beauty of this is that most of our students are working full time, and they tend to be midlife learners, so that they also are raising families or taking care of others within their community while they're doing their programs. So the flexibility of it is quite wonderful. We think we provide a lot of support too. We assign a faculty advisor from the time our students enter the program. And then let's say I'm your faculty advisor. I will stay with you, work out your program plan for you, help you make critical decisions about what courses are best suited for you, and then help move you toward your ultimate capstone or dissertation research.
Thank you very much, Luann. So we're coming into the last three big questions. These are rapid fire, if you will. Maybe not rapid fire, but quick answers here that come off the top of your head from our local amazing scholar and practitioner. So, all right, last question related to kind of the Saybrook experience. What does the term humanistic mean to you?
For me, that's the part where you become everything you can be. that you recognize your full potential. So I fall back on my early learnings with Abraham Maslow and the idea of self-actualization. I think humanistic recognizes the potential of all individuals to become better versions of themselves and also attends to supporting each other in a web of support and compassion to enable that, to support that. I lift you up.
Beautiful. What a fabulous answer. Thank you for that. Then, with all that's out there right now in the world, the challenges, the struggles that individuals and communities face, I want to leave our audience today with a bit of Luann Fortune goodness advice, right? What are 3 things people can do right now, just right now, to improve their health?
Every day, find something to take care of your mind. Find something to take care of your body. Find some way to take care of your spirit every day. And there are so many things you can choose from. And if you're not sure what those are, contact me. I'll give you a whole model.
Well, that's a great segue into, before you go, where can people find you on the web? Do you have any books, articles, recordings you want to direct people towards as we end today?
Oh, you can look me up on Google. You can check me out. I have a website. You can find me under Luann Fortune. And you can also find me at Saybrook, lfortune at saybrook.edu.
Wonderful. Well, what a pleasure it was to spend this time with you today. You are getting dark there on the East Coast, I see, and it's probably time for us to wrap up. Thank you so much for a lovely conversation.
Thank you, Nathan, and thank you, listeners, for staying with us. It's been a real pleasure.
All right, everyone. I want to thank Dr. Fortune again for her incredible insights today. I hope you enjoyed Luann as much as I did. Remember her 3 takeaways. She talked about making sure we take care of our mind, our body, and our spirit. Very good, very sage advice. If you want to see the video elements, we've created these segments available via Saybrook's YouTube channel and on social media. And if you'd like to support the podcast, which I hope you do, go to Apple iTunes and leave a 5-star rating and review and subscribe so you can get episodes as they come out. If Spotify is your preferred platform, leave that 5-star rating and make sure to follow us. And you can, of course, subscribe to us on most major podcast platforms, including Google Podcasts, Stitcher, Pandora, one of my favorites, Pocket Casts, and many others. Remember to check our show notes out for information on today's guests, including links to websites, books, etc. For more about our mind-body medicine program or the university, go to www.saybrook.edu. Click on areas of study at the top of the page and locate the program to learn more. Or simply Google Saybrook University Mind-Body Medicine Program. Signing off. Take care.